expected to come up with a publication. Like in Uganda, Makerere, Mbarara University, at least you need to have at least 2 publications. Yeah, but one of the publications that are very easy to do and very fast to do is a scoping review paper. And why is this important? Because it is not easy to, because of the delays, getting results, the rejections, especially that come with our empirical data. Yeah, some of these are it can be a tasking, but you can have a literature review paper that can help. So, but just before the scoping review, it is important to understand why literature review. Of course, we don't want to reinvent the wheel. You don't want to start something because we believe that for science to be advanced, you must refer to your elders. Or I don't know those of you that follow Google Scholar. Their slogan is standing on the shoulders of giants. That literally means that where you are, the kind of area that you're researching in, it may be rare for you to come up with a completely new area. Yeah, it may be very rare. So there is a lot of research that has been carried out. Of course, as part of right from the background, the literature review chapter 2, it is very intentional that we look at what other researchers have written about and then compare notes and see where can we improve. How do we contest the things that you feel they are not correct? Yeah. What are those existing interventions that have been done by other people? And why? Because we don't want to fail. You don't want to do something that will fail. You need to distinguish if a certain researcher carried out a study in, let's say, in Kenya, and now you want to do, probably it didn't get the results. How sure are you? How do you convince us that you will do the same intervention and you get the same results? Yeah, so when we look at literature, of course, it helps us to discover what other people have documented, what are the areas of future research, and then because usually when people are writing their work, they always provide the areas of future research. They provide recommendations, they give conclusions. So you will, of course, you can get an idea of how to extend someone's work. For example, as we are here struggling with ideas, you can just simply extend someone's work and say, I think Dr. Wilson did something about this framework, or maybe this. I want to proceed by this. And that is literature. So, of course, in the of course, this literature review, it emerged, of course, emerged in the 1970s, especially in the social sciences field. In the early, of course, I don't know you guys, I'm sure you guys have heard about a gentleman called Cochrane. You've heard about Cochrane's systematic reviews, Cochrane database, So this, in the early 1970s, Dr. Archie Cochrane noted that many medical care decisions were made without reliable and up-to-date evidence. Yeah, because before, let me give you an example of COVID-19. You had people talking about Pfizer is 90% effective. AstraZeneca is 60%. Why? Because they want, of course, that is a product of, that is a product of many clinical trials that have been carried out. But just because you carried out one clinical trial and it gave you results, it does not mean that that should be the standard. So just because you carried out a study and it was successful in the USA, it does not actually mean that it can be successful in Uganda. Yeah, you guys are in IT, those of you that are not. But for example, in IT, you realize that just because an intervention worked very well in China, it may shock you when you bring that same intervention and implement it in Uganda. Because China has stable electricity, they have smartphone devices. But here in Uganda, before this call ends, someone will just be disconnected because of no internet. Electricity will just disappear. Those are the challenges. Now, to bring such an intervention in such a fragile environment, so you need to, so for you to make a decision to recommend a certain intervention, you need to look at what other people have done. If there is a study that was carried out in China, in Kenya, in Namibia, Botswana, South Africa, Uganda, if they exist, you look at them. And then so that before you recommend a given intervention, you should have looked at how it has fared in different contexts, and then you can be able to make a reliable decision. So Dr. Archie Cochrane, he noted that many medical care decisions were made without reliable and up-to-date evidence. So in that, of course, when he realized that, that's when he thought, before you make a decision, a medical care decision, you need to look at what is the current evidence. Before now we are talking about Lekapava, that HIV, or before implementing a certain drug, you need to first prove, you first bring these studies together, look at what they did, how effective. If you go to Kenya, it was effective in 90% effective, Uganda 87%, Rwanda 92%, and then you bring them together. Before that, one can help you to either recommend that this intervention is actually it is reliable, or it is up to, yeah, it is reliable. You can make a thorough decision. So why literature review? Of course, it provides key insights into a particular scholarly topic, and it critically examines different sources of information, and it provides the best form of evidence that is available to clinicians. So, of course, where do we start from? As we are looking at literature, it is important, of course, you need to ask yourself, what is actually wrong out there? Now, this person, I love this figure. You realize this guy is just asking themselves, and then they felt like, we need to come up with he came up with a bicycle with a square wheels. But then, of course, he's sweating because it is not actually moving on a flat ground. Yeah, so we don't want you to, the goal of literature, we don't want you to sweat. You reach somewhere and you're stuck. No, we need to read to see what have other people done, what is wrong out there. And then this will help us to come up with a clear research question. And then we will not reinvent the wheel. We will just simply understand what is missing, and then we can be able to see how we can do it better. Of course, there are different types of reviews that you may probably be. So we have the rapid reviews, we have the narrative, the systematic scoping, and then we also have protocol for reviews. Just briefly, when we look at the rapid reviews, this is, you guys remember the time of COVID-19. People did not know about what was happening. People were coughing, there were those whatever. So, of course, for us to understand, especially to respond to an urgent clinical or public health related question, we need to get literature. So you can carry out a rapid review, which is used to provide timely and valid view of evidence. For example, like in medicine, people produce case reports, they talk about maybe their experiences. So you can carry out a rapid review. For example, if there is need to respond to an urgent clinical and public health related question. So it is used, of course, this utilizes shorter time frames, of course, as opposed to the systematic or scoping reviews, and it provides a timely and valid view of evidence. Yeah. So they are, of course, they can just simply, you can carry out, it's more like how you look at literature, but the goal, the intention is to just show or to tell people what is actually happening about this urgent or public health research question that has emerged. So the goal of this is to provide robust analysis or easily retrievable evidence within less than 6 weeks. Yeah, so you realize that this is a very shorter period of time. So if there is, let's say, an outbreak and you want to write about what people have, document what has been discovered, or you want to respond to an urgent clinical public health related questions, you can carry out a rapid review. And we have narrative reviews. Now, narrative reviews, they are more of our normal literature review, our chapter 2. So these ones are a discussion of important topics on a theoretical point of view, and they are considered, of course, as an important educational tool as far as education or medical education is concerned. They take a less formal approach than systematic reviews, and they do not require presentation of more rigorous aspects or character. For example, reporting the bias, reporting the methodology, the search terms or the databases used, inclusion. No, this one it's as long as you have got a topic and you want to talk about it, you don't need to go through all this process. So you can carry out a normal narrative review. For example, when you're writing your literature review chapter, you don't need to describe which search terms were used, which databases. No, you just get a topic. There was a study in China by Gently and colleagues. It talked about artificial intelligence in maternal and all these aspects. Then another study was carried out in Kenya, blah, 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 blah. So that is a narrative review. So you have a point, you have a study or a topic, but you want to expand it by showing what has been done elsewhere. Please, you are allowed to ask any questions. You can type them in the chat. Yeah, you can type them in the chat. You can, so that we don't lose you along the way. Then we have the big brothers, the big guys, which are called the systematic reviews. But today we are not going to look at systematic reviews. We're going to look at scoping review. But we can't look at scoping reviews without looking at this. But briefly, systematic reviews, this is an investigation of a clearly formulated question that uses methodical and explicit steps to identify, select, and critically appraise relevant research and to collect and analyze data from any appropriate studies that may be found. Yeah, so this review, of course, is conducted according to clearly stated. Now, put the words in brackets. Clearly stated scientific research methods. And the goal is that it is designed to minimize biases and errors that are inherent to traditional narrative reviews. Like I told you in the narrative review, you don't have to report this systematic how the risk of bias, all those details, you don't need to capture them. But in systematic review, because you will not just bring a paper and just assess it. No, you need to state, why did you choose this paper? What was the risk? Did you choose it because it contains information, or it was because you had your own biases? That's why you have to state that there are checklists you must use. For example, the PRISMA checklist. You must state the risk of bias. some of you may wonder, but we shall look at it when we have another session about systematic reviews. Yeah, so we'll also organize, especially, so, but this one, there is a clear, you have a clearly formulated question that uses methodical and explicit steps. So originally, systematic reviews were used. That's why they were, for example, what I was talking about, you have an intervention, but before recommending it as policy or before recommending, you need to see where has it been carried out. So those of you that are inclined to a bit medical practice, there is what they call randomized control trials. So a randomized control trial, it means that you have either two or more groups. One group is exposed to an intervention and another is a control group. So let's say you get two groups of people, two groups of participants or patients. One, you give them an intervention. Let's say if you want to assess the effectiveness of Panadol on treating migraine headache. So you just give these guys Panadol, a group you give it Panadol, and then another group you give them a certain drug, or maybe like what we call what is it called, a placebo, or you cannot give them. You can simply so you get someone is bringing me something to drink. So hello Dale, thank you so much. Yes, I'm okay. Yeah, all right. So you get this one group, you give them an intervention, then you follow them up for respect. Then another group you don't give them. You may not give them, or you may give them something that is not actually Panadol. For them, they swallow thinking they are taking Panadol, yet they are not taking Panadol. Yeah, it is probably like chalk, or something that looks like a tablet. And then you observe, you kind of follow them for a period of time, and then you can then after you document the results, you compare. So maybe at end line you realize that actually the people that were exposed to the intervention, there was a significant difference, or maybe there was no difference. Maybe it treated the disease 90%. That is another city. Now, the systematic reviews were meant to get those different the RCTs that explain the effectiveness of interventions, then look at them. So there is a study that was done in Kenya or maybe China, depending on the availability, then pull them together, look at them. That's why you've heard about most systematic reviews, they are paired with, or they go with a meta-analysis. Look at the p values or the ratios that were carried out that were reported in China, Ghana, and whatever, and then you come up with a figure to come and say, okay, now based on what we found out, based on the 7 studies, of course, after specifying the inclusion and the exclusion criteria, reporting the bias. So based on the 7 studies, digital health interventions or Panadol is effective in treating migraine headache. So without these RCTs, of course, originally they used them to, before recommending a given intervention, they had to first look at where else has this intervention been done, and how can we recommend it, or how can we, before recommending it to general use, and then after looking at the systematic review, then they are able to recommend. Yeah, so we'll get time and I will explain to you also the steps, but it has a few characteristics like clearly stated title and objectives, a comprehensive strategy to search for relevant studies. You must state how did you get the studies? It's not that every study that you land on you will include. No, you must provide that strategy. And then you have to explain the criteria for the inclusion and exclusion. And then you have to describe the characteristics of each study that is included. And then, of course, you have to provide a comprehensive list of all studies included with their justification. That's why you have to report things like a Prisma flow diagram. Those of you that have read the systematic reviews, yeah, you must show which studies did you include, how many did you exclude, why did you exclude them, up to those ones that you include. It is a systematic process, yeah? So a systematic review is not systematic searching of literature. No, of course. So you don't just come up with a paper and say, I've come up with a systematic literature review paper. No, that is not scientifically correct. Yeah. That is maybe a narrative review, a scoping review, but a systematic review, I must see, you have to state, show us your Prisma checklist. You need to show us, you have to register it in Prospero. There are some, you have to register it because for you to fill the Prisma checklist, you have to include that number. We must include how did you assess the quality of the studies? How did you include how did you assess the risk of bias? Yeah, all those must be there. Yeah, but of course that was the typical, but then of course different schools of thoughts keep on coming, and that's why you'll see a systematic review that does not have, that also reports pilot studies, that reports feasibility studies, yeah, because different schools of thought keep on changing, but it depends on what someone subscribes to. If you find a reviewer of a journal that believes that systematic reviews must be from randomized controlled trials, they will not accept your paper. But if you find these hybrid reviewers that agree with different schools of thoughts, you can have your systematic review go through. Yeah, and then of course, I've already talked about this. So some of them you have to include the meta-analysis. Then we have those ones that are called meta-synthesis that report qualitative findings. Yeah, and this is what we see here, the qualitative, let me just get my pointer. Yes, the qualitative synthesis, or what we call the meta-synthesis. Yeah, and then also you have to, so you need to, so if you want to be an author for a good systematic review, you must formulate a question, conduct a literature search, refine the search by applying predetermined inclusion and exclusion criteria, and then of course, extractions of their appropriate data, assess their quality and validity, synthesize, interpret, and report the data. Yeah, for more details, there is this, you can check out some of these resources and then they can provide more details. Now, that is systematic review. I think we've talked about rapid reviews that are carried out for a short, especially if you want to report about a clinical public health problem that has emerged within a shorter time frame. Then we have talked about the narrative review, where you want to discuss about a point about the topic without necessarily following these procedures. Then we've talked about the systematic review that follows a systematic process to map literature and also to reporting their bias, especially to ascertain the effectiveness of an intervention. So if your study, of course you guys probably, but if your study is about assessing the effectiveness of a given intervention, yeah, let's say you have an objective of assessing the effectiveness of a given intervention on a certain condition, then you can carry out a systematic review by looking at different studies that assess the effectiveness or the impact, and then you pull them together, and then you come out with a systematic review. Yeah. Questions are welcome. We will, don't worry, we'll have a session about systematic review. Yeah, and then maybe I think maybe that should be the next, so that we can, but that you may not do it but it's also good to know, because you guys are PhD holders. Don't worry, you will get your PhDs, but you'll get a student that wants to do a systematic review, and then you don't have to stop them. Don't say, why don't you do a scoping review? Because that's what you know. You have to know all things. Now, scoping reviews, which is our central point of focus. I thought we would end in 1 hour, but it feels like the time is running. But don't worry. If you feel like you want to drop off, please, you are very much allowed. And those of you that have seen, I think some people have joined us. You guys are very welcome. Hey. I have my bosses on the call. You guys, I'm so happy to see you. Yes. Yeah, so now when we come to the scoping review, now the scoping review, which is our main focus or our main topic today, this is really the scoping review is meant to map, for example, if there is literature about a given topic, you want to understand a given literature about an available topic. Yeah, it is very important to you can and then of course in this case you want to look at the key concepts, what is being talked about a given topic. For example, if you have a topic about, now we are in a generation of artificial intelligence, we are in, maternal health, or digital health, but maybe those are broader terms, but probably you want to look at the application of, let's say, ICT in maternal and neonatal care. Now, we carry out the scoping reviews, of course, they can help us to understand what is being talked about on a given topic. So we carry out these ones to understand the phenomenon and also to evaluate where research on the topic has or has not been completed. So usually, if you want to understand what are people talking about, you have a topic, but then you want to identify what are the key concepts, what are the theories, what are maybe the strengths and weaknesses. You can carry out about a given topic. You can carry out a scoping review, because these are usually the first step in, sometimes they are considered the first step for conducting a systematic review. So why do we do a scoping review? Number one is to examine the extent, the range, and the nature of available literature on a topic or a question. So if you want to know what is the amount of data or on a given topic or a question, you carry out a scoping review. If you want to determine the value of undertaking a full systematic review that I was talking about, you can also carry out a scoping review. And also, if you want to summarize, disseminate research findings across the body of research evidence, you can also carry out a scoping review. And if you want to identify research gaps in the literature to aid planning and commissioning of future research, you can also carry out a scoping review. So what is the difference between these two? We have the systematic and we have the scoping review. So the systematic review attempts to identify or appraise and synthesize all the empirical evidence to answer a specific and focused research question. But on the other hand, it follows a systematic approach to map evidence on a topic and identify main concepts, theories, sources, and knowledge gaps. That is a scoping review. So a systematic review is very focused. So the difference in the systematic and scoping is just the focus. Systematic review is very specific to a given aspect. For example, you want to understand the effect of a given intervention on maybe neonatal outcomes. So you carry out, so that is what you want to look at. But a scoping review, you want maybe to look at, which interventions have been used to improve neonatal outcomes. So the systematic review wants to look at the effect of these outcomes, these interventions. Let's say you want to look at the effectiveness of mobile health interventions on maternal and neonatal outcomes. So what you're looking at, so it means if you're saying that the effectiveness, you're not going to look at anything else. You want maybe to look at the p-values, the risk ratios, the odds ratios, all those aspects. But for a scoping review, you can record anything, even those that talk about as long as the paper talks about an intervention for improving maternal and neonatal outcomes. So you can carry out a scoping review. So the systematic is focused, but scoping is general. You want to identify what has been talked about, which interventions have been used, what are their strengths and weaknesses, and what are the knowledge gaps. So, sorry. Yeah, so here we have, of course, more clear difference. We have, when we look at scoping reviews and systematic reviews, authors in scoping reviews can be one or more authors, but in systematic, these have to be team-based. But this depends, really. Yeah, and then research question, of course, in scoping reviews, they are more focused. Of course, they can be focused or broader, but in systematic reviews, they are focused, really. They are specific. Yeah, eligibility criteria in scoping reviews, scoping reviews are flexible. For example, if you go and your intention was to find about interventions used in improving maternal health and all those aspects. Yeah, you can, and you go and you find few you can include. You can say you want to look at interventions, their strengths and weaknesses. So it is flexible compared to systematic reviews where they are very rigid. If you set a criteria, you must follow that criteria. And then the search strategy still in scoping reviews, it is iterative, and then compared to the systematic, which is set, because that's why in systematic reviews, you must register the systematic review before you conduct a systematic review. And then results, scoping reviews, usually they yield larger results because they are general, while systematic reviews, they are usually fewer because you're specific to what you want. But in scoping reviews, that you'll include studies, pilot studies, or feasibility studies, or cross-sectional. You include also the randomized control trial. But in systematic reviews, you'll find most of them are maybe RCTs, etc. And the results are a bit few. And then appraisal, you can carry out an appraisal in scoping reviews. And then, of course, but in systematic review, it is compulsory. Yeah, but of course, like I said, things keep changing. They keep changing because of different schools of thought. People, we go to different schools. For example, you'll find someone in a different university. They are taught about certain aspects. Maybe they tell you, for us, we don't need research questions. But then you go to another, they tell you, you must have a research question. So we have those different schools of thoughts. Yeah, but in some that's why we have hybrids of systematic reviews that will accommodate everything, whether RCTs or observational studies. And to that end, we have seen even several checklists that have been developed, especially if you're carrying out a systematic review, but you want to assess the quality of diverse studies. And then protocol and reporting guideline in the scoping review, there is what we call the PRISIMA SCR. PRISIMA is preferred reporting items for systematic and meta-analysis, but they have the SCR for scoping reviews, but in systematic reviews, you have to have PRISIMA. For proto, you have to have the PRISIMA general. So there are these checklists that you can always refer to. And then, of course, analysis. It is, you can look at the overview and the themes that have been reported as far as you're working on scoping reviews. While in systematic reviews, there you have to appraise, you have to carry out a formal synthesis. That's why when you're looking at systematic reviews, they have to report the main findings, those p-values, odds ratios, risk ratios, those whatever confidence, they are intentional, as opposed to scoping review. Yeah, so I think that's very, yes, Vincent, thank you so much. I will share these resources. Don't worry, I'll share them through. Yeah. And then, so when to consider carrying out a systematic review, like I've already said, when the aim is to answer a focused or clinical question, and also to confirm current practice, address any variation, and also identify new practices, address the feasibility, appropriateness, and meaningfulness of it, or effectiveness of a certain treatment or practice. And when you want to identify and investigate conflicting results, you can carry out a systematic review. And if you want to produce statements to guide decision making, so you realize that most of the clinician friends of ours, for them, they regard a systematic review more highly. And when you're looking at the hierarchy of evidence or guiding decision making, systematic review usually takes the first priority, followed by RCTs. I think RCTs, systematic reviews, then followed by these other types of reviews. And when do you consider carrying out a scoping review? Of course, when you have a broad research question or topic, and then, or you have multiple research questions, and then you want to clarify or examine key concepts, topics, or areas, when you want to conduct a landscape or environmental scan, when you want to identify the knowledge gaps, when it is impractical to conduct the risk of bias assessments. We are going to look at this when we have a session of conducting systematic reviews. And then also, if it incorporates multiple study designs. For example, you get a paper, but it is a cross-sectional study. You get another one, it is a feasibility study. You get another one, it is. So if you have multiple studies, if you find another one, it is an RCT. So you can conduct a scoping review, highlighting different themes that have been noted. So I put some examples of scoping reviews that we have carried out. This is one of reviews that we carried out. This was about enablers and challenges of integrating digital health into medical education curricula. And we have it is available. You guys can check it out. Yeah, you can have as many people as you can, of course, especially if you want to inform, you can bring them on board. And then there is another one that we published in Implementation Science Journal. It is also a scoping review that you can also check out, especially that can guide accordingly. So in addition, of course, these scoping reviews, of course, they provide, okay. Can someone, oh, okay. Yeah, I will do, okay. Great. Can someone use both systematic and scoping in one research topic if they can do the needful? I think yes, if it is, for example, maybe a bigger study, if you have different objectives. But I would, of course, because the task is, so I think I would recommend in an event, usually we always consider one. Yeah, but it is no harm. You may find you have your study, but like we have seen, for example, we've said that some people carry out scoping reviews actually as a pre-phase, as a first phase for carrying out a systematic review. So it is accepted. So it depends on how much you can get the data that is available. So there is no harm if you can do that. Yeah, yeah. So but you have to make sure that you follow the right procedures, of course, of carrying out this both. So scoping reviews, of course, as we highlight, they allow for identification of types of available evidence and research gaps in the field, of course, based on a methodologically robust and transparent process. They also examine how research is conducted or reported on a certain topic or a field by clarifying concept definitions, characteristics, or factors. For example, this study, this review we carried out. So this one is the one of the reasons why I carried out this scoping review. I wanted to inform because I looked at how the medical field, of course, we are in a generation of AI, digital health, but then you realize that the delivery of our medical curricula is actually, yeah, of course, it is very dense, it is densely, there is a lot of, the curriculum is big, but you realize that we are sending these doctors, these clinicians, nurses, to hospitals that are actually digitized. You go to a hospital and they have systems, clinical decision support systems, and someone does not know how to go about them. And we're like, how about we introduce this in the medical curricula? That's how we have key policy makers like this. Joseph Ngonzi is our DVC. Rhoda Wanyenze is the Dean of School of Public Health. We have we have policy makers like commission. We have a commissioner, Dr. Richard Mugahi. We have some people from WHO, Geoffrey Namara. Yeah, so we were trying to see how can we bring these different people on board, so we carried out this review to guide, for example, because when you're reading the WHO digital health agenda, they actually advocate for integration of digital health in medical education, in formal and informal medical education. But then you realize that in Africa, of course, when you look at countries like Australia, in the US, Germany, they have integrated. But here in Uganda, in Africa, it is not there. So we had to carry out this systematic scoping review to show what has been done elsewhere. You know, so we had to bring studies in Germany, studies in America, in Saudi Arabia, to show that actually in Africa there is nothing. That is, so when we talk about that, we carry out this to understand the research gap, yeah, to show the research gap. This is what we are trying to do. So we did not just carry out this review for now. No, we wanted to inform. If you're going to integrate digital health in medical curriculum, what do you need to consider? Number one, we put the enablers. We talked about now the challenges, but we did not stop there. We actually provided the implementation strategies by addressing every challenge with a strategy, so that as the people, as the policymakers are going to take a step, they are guided. So if someone wants to, so in future, if someone wants to integrate digital health in medical curriculum, they can read our scoping review and they can see what challenges they need to expect what should be done. We also highlight what needs to be done, etc. and etc. Yes, and also, so we carried out this study, this scoping review. We wanted to develop a framework. So you can also carry out a scoping review to come up with a framework with, let's say, it can be a theoretical. For example, there is a well-known framework, especially in the field of implementation science, that is the CIFA framework, which is the Consolidated Framework for Implementation Research. Researchers did not go to the field and get data and they were like, let us come up with CIFA. No, they just synthesized literature that was existing. So they looked at papers that talked about implementation research. They mapped each of those papers and they came up with CIFA with its 5 domains: the characteristics of the intervention, the inner setting, the outer setting, the process of intervention, the characteristics of individuals. They further went ahead to get the construct. So when we looked at this, we're like, we also need to come up with a framework that can guide the implementation of mHealth interventions, because the other ones are general. But how about because now for me, being digital health, this is my specialty. So we had to come up with a paper. So we went through literature. We looked at different frameworks that have been done: the COMBI model, the CIFA, the REAIM framework, the NPT, and we got all these theoretical frameworks. And then we conceptualized. There is what, those of you that study philosophy, they talk about constructivism. Yeah, so we had to get different ideas so that we come up with a framework that can guide the implementation of mHealth interventions. And this was a scoping review. So you cannot be there. Of course, we didn't have money for funding. So you cannot be there and say, I don't have money to publish a paper. You can just go through literature and look out what has been done, especially in your area. If you're looking at artificial intelligence, if you're looking at clinical decision support systems, if you're looking at, what have other researchers talked about, and then you can pick out which question you can answer. So this is the goal. So the reviews, they can help us to actually to identify, of course, to inform clinical practice guidelines by identifying the existing guidelines which could be adopted or adapted, So you can look at what have other researchers done, and then you can change, modify them, and also you can provide knowledge to the users so that they can understand the available evidence to help with prioritization of your research question. Another thing, as you're coming up with your scoping review, of course, you need to think about the scoping review team. Of course, this can be completed. A scoping review cannot be completed by one person, and it requires a team. Yeah, this depends. There are people that have skills, but sometimes you need someone to review the work. You need an expert. Now, and so you need to have them. Yeah, so the scoping review team must include content, of course, content, methodological, and information science experts. That's why, for example, there is the guidance provided by Joanne and Briggs Institute, or the JBI. You will see in the next slides. It guides that, of course, scoping reviews must have teams with people that have knowledge about that specific throughout your scoping review. So that's why in our composition, we had, for example, here we have different team members. Me, I am a health informatics person, but we had experts, for example, from the medical education. We had these people to guide, for example, as they are reading, they can give us comments on what can be done. So we are saying that you need to have a team. So as you're getting people, the most people that are helpful, you can have a librarian, the information science people. When you get papers and you tell them they can get the papers for you, they can give you, they can help refine, because their role is information science. How do you mix the Boolean searches, etc.? And then, of course, yes. So there is this paper put, and then there is this link. You can further check it out, and you can provide some guidance on how you can do the scoping review. So as we are writing a scoping review, there are specific review methodologies or aspects that you need to think about. Number one, we've already talked about PRISIMA, which is the preferred reporting items for systematic reviews and meta-analysis. If you're reviewing a paper or someone is talking about systematic review and they are not talking about PRISIMA, just know that is not, they don't know what they are talking about. This must be there because you have to enhance coherency. And then, of course, you can also come up with your protocol. Protocol is like a proposal of your paper, of your scoping review. You can also register it. And then we have the PRISIMA for scoping review, which you must have if you're coming up with a scoping review. This is a 22-item checklist that captures key elements of a scoping review. Then you need to get acquainted with the Joanna Briggs Institute and AXI and O'Malley. These are some of they provide the steps that you must include in your scoping review. So for us to get started or to do what needs to be there in this systematic review, so AXI and O'Malley, they provide 6 steps for you to carry out your scoping review. Number one, you have to identify the research question. What is the research question that you want to search out for, or you want that your scoping review is based on? And then you need to specify how will you identify the relevant studies. This is when you talk about, the keywords, the databases that you're going to use. Then how will you study it? How will you include the studies? This is about, study selection, the inclusion and the exclusion criteria. You have to state which kind of study, which kind of inclusion and exclusion criteria you're basing on. Then you have to talk about the charting of data. How will you report the data? How will you chart the data? Then how will you summarize and report that? That's why you will find a table. They have tables that highlight the findings, and then then below the tables they explain or they report further details. And then the last stage is consultation. So AXI and O'Malley, they advise that you can always present your findings at conferences or meetings or to experts so that they can give you feedback before you incorporate it. But most times, this stage is not mandatory. You can publish your paper as long as these upper here are done, but it would be good to add consultation. So that is according to AXI and O'Malley. So when you're talking about you're using the scoping review, you need to know about this scoping review methodology, which is by AXI and O'Malley, that highlights these 6 key steps that you must include. And then there is this also, Joanna and Briggs, they highlight the format that you need to have. You need to have the protocol, or you need to provide the title, the background, the review questions and objectives, state the eligibility criteria. This should include comprehensive searching to identify the sources of evidence, and then, of course, how will you select the relevant sources? How will you screen for the study? This is where we find our PRISIMA flowchart diagram, and then how will you extract and chart the results? And they also have to provide the conclusions and implications. So these are almost the same, but you can choose the Joanna Briggs Institute version. You can also highlight the AXI and O'Malley. Yeah, I'm familiar with the AXI and O'Malley, but I've reviewed papers that follow Joanna and Briggs Institute format to be able to come up with their reviews. Now, we have, of course, we have other methodological issues that you need to think about as you're coming up with your scoping reviews. Number one is the scope. You can carry out a scoping review. Let me first take some cup of tea. So, are we clear? I may be, please, are you guys following me, or there is something I need to clarify? Please, you can always.
No, we are on. Thanks, Doc. We are enjoying the presentation.
Oh, thank you so much, Vincent.
Yeah.
Okay, Asa, thank you so much. So there are other methodological issues, for example, the scope. So you might ask yourself, how big should be a scoping review? When I was doing a scoping review for my PhD work, I wanted to look at mobile health interventions that have been used in public-private mix in TB care. Yeah, so those of you that are familiar with TB, it is what they call PPM, or public-private mix. So my research was about how can we, of course, how are patients referred from private public hospitals to receive care. So I wanted to get studies that were carried out, in Uganda. Yeah, in Uganda, but I could not find any. So what does that mean? Did that mean that I should stop carrying out a study? No, because we have seen in the differences, we have said that the scoping review is flexible. You can always change, especially to suit what you're looking for. So I went ahead to Africa. I didn't find any study. I went to developing countries. I think there were just like a few studies. So until I had to open it up, any study that reported an intervention that was mobile health intervention for public, private, or in private sector, include it there. So now my scope moved from Uganda, which was a bit limiting, to a global scale. So you're not limited. Don't just come and say, because your study, the case study is, mental health outcomes in Uganda. So then you come and say, I'm going to carry out a scoping review of, of these interventions in Uganda. No, a person that understands, they will laugh at you, because you may not know what you're talking about. Your study may be the first study in Uganda. So where are you going to get the papers to include in your scoping review? So you need to think about, now, when we are thinking about the scope, you can always broaden. So if you focus, you can begin with the region, you talk about maybe Africa. If you get studies in Uganda that are enough, that's well and good. If you don't get, you can expand, say maybe regional, maybe Africa, or maybe high-income countries or developing countries, etc. and etc. You're not, as long as you get the results that are of yeah, so as long as you get the results that are actually that are sufficient, yeah. So don't limit yourself. Say, hey, I am stuck. No. Don't limit yourself. Number two, keywords. You need to think about the keywords. Now, you've heard about the Boolean search, where you put things and, or, not, etc. Worry not. These days, you don't have to worry. You can, I think you can even go to ChatGPT and you say, I have this study. Yeah, I have this study. Please generate for me a search strategy. You just put it there, you copy it and take it in Google Scholar or Science Direct or IEEE, and they will generate for you. In PubMed, you don't need to worry. You just need to get, so PubMed is, those of you that are not biomedical, it is a biomedical database. So you go to PubMed, you just type keywords, your words about your study. For example, if your study is about mental health, mental health in higher institutions of learning, you can put your topic there, and they will bring all the studies they build. I will show you as we are concluding. I will show you how you search for papers in PubMed and then Google Scholar as we are concluding, so that you guys can go and get started with your review papers. Now, so these ones, they generate even the search string. You don't need to worry. I will show you how a search string looks like. Yes, another aspect is years of inclusion. You might be asking, how long should my scoping review, because you have to state the years. You know, which literature are you looking at? So there is no limit. You can say maybe you want to look at this literature, maybe current literature, say maybe 5 years, let's say 2020 to 2026. Yeah, when they ask you, like, we wanted to look at the modern literature. And then you can carry out a study maybe about, maybe 10 years, so you're not limited. Yeah, but these ones you can always discuss with your supervisor, then they can guide you accordingly. And then, yeah, so I've already talked about what do you need as you're carrying out, identifying the research question. How do you identify the relevant studies? Now, this is according to Axie and O'Malley. So, of course, identifying the research question, there is a framework that is commonly used especially in systematic reviews. So this is called the PICO. So PICO stands for the patient, the population. Patient can be a population, or can be a problem. Then talk about the intervention or the exposure, then the comparator, and then the outcomes. But in scoping review, the JBI, they recommend it to help researchers to construct clear and meaningful titles and inclusion criteria for the scoping review by the JBI. So for them, they highlight the PCC, which is the patient or the population or the problem, then the concept and the context. Yeah, it is as simple as this. But for systematic reviews, you have to think about these aspects. You have to talk about the intervention, the comparator, and then also the outcomes. So you can read more about these frameworks. They can guide you accordingly. And then, how do you identify the relevant studies? Of course, you identify the relevant studies through a comprehensive search strategy. Yeah, of course, the search strategy should be comprehensive. It should consider multiple databases. It should also consider various types of evidence, and it should be iterative so that it allows or it accommodates revisions that are accepted, of course, especially in scoping reviews. And then, of course, you need to document each of these, your strategy. You don't just go to Google Scholar or to PubMed or to and you just put things and they give you results, and no, you must document everything. So we have these well-known academic databases. We have the PubMed. Those of you that are in medicine, you're familiar. Then we have Scopus. MUST at Mbarara University, the library gave us news that we have access to Scopus. And then, so I believe if you have MUST web, you need to make sure that you have the email or address for email address for MUST, std.must, and then so that you can be able to gain some of those accesses. Then we have the clinicaltrials.gov, especially if you want to know which kind of clinical trials have been carried out, for your systematic review. So this is how you identify the relevant. You must develop a comprehensive search strategy that is made up of your keywords, and you put those keywords in these databases, and then they give you have to document the results and they give you the results that you want. We shall ask some of, and then we can share how do you put some of those, and then you can get started. Of course, step number 3, study selection. Yeah, so you need to select relevant studies based on your eligibility criteria. Of course, not every study is relevant, so you have to specify your eligibility criteria, and then those are the studies that you have to include. Yeah, so we've put a sample slide of how PICO can be adopted or can be used, especially if you want to understand some of the if you want to come up with the studies or selecting the studies by highlighting, for example, this is the PICO talks about. So this is, of course, this is for systematic reviews. And then, of course, we are saying we are not going to spend a lot of time on it. We will have another session for systematic reviews, and we shall look at these things. And then we have step 4. But the key point here in study selection, only select relevant studies that are based on your eligibility criteria. Yeah. Very importantly, there are different types of studies. So you need, but sometimes we don't include studies. Let's say like we don't include studies like editorials, letters, opinion pieces, because they are shallow. They are not comprehensive. They don't contain empirical research. So for us in these scoping reviews, you have to carry out report empirical data, studies that report empirical data that you can include in your work. Yeah. So you will search, and they will bring you also existing scoping reviews. You don't have to include them. No, you just exclude them because your focus, you want those empirical studies. And then step number 4, charting and extracting data. Of course, there is no standardized format, but usually you can always, there is what the JBI provides a template that highlights the source or the characteristics of the results, for example, from a given study. Yes, and then you can be able to document, but mostly you can always check out, read about the JBI, and then you can see, because there are several aspects like the country, the participants' demographics. As you're doing all these things, you're extracting the data. And then we have step 5, which is collecting, summarizing, and reporting results. Of course, you need to ask yourself, what do I include in my study? You need to report, of course, the data that aligns with your objective. If it does not fall in the confines of your objective, there is no need of including it. And then, of course, the data that addresses your research question or research questions. And then, of course, that includes the aspects of the PCC or the PICO elements. Yeah, so there is also, for those of us that will do systematic reviews, there are several other approaches like the GRADE, which is grading of recommendations, assessments, and development and evaluation, that has been published in BMJ, also to guide some of these reporting of the results. And then, yeah, so you can also, during still under correcting and summarizing, you can just put, for example, of course, you can report the search results, you can put the results, you can put the tables. That's why in some reviews we have tables, you have tables, and then you have diagrams, and then descriptive text. Yeah, so most commonly we have descriptive text. Tables, usually they provide the summary or the characteristics of the studies included. Yeah, but you have to provide a descriptive text that highlights each of these components. And then of course, importantly, don't forget the Prisma flow diagram. Yeah, this is for both systematic reviews and also because it's still in scoping reviews, we have to use Prisima because we have the Prisima SCR. So this, it highlights how did you identify the studies, how were the studies screened, and which ones were included. So you must, so these are the number of studies that were included, and then you need to show how many of them were removed, because some of them, by highlighting, let's say, the duplicates, the records that were ineligible, and then you proceed. Of course, after excluding them, you have to specify the number. You have to, and then further, you have to include which records were screened, maybe on the title, and then based on the title, how many were excluded, and then how many were when you went further till you go down to the studies that were included. So you might find here you had, like, let's say, if you have a bad search criteria, you may get a lot of results. But if you have a very clear and specific search, building your search criteria, then it can be very easy. But for you to help, like I've told, use these available tools like the Copilot, LLMs. You can put your keywords and you tell it, you prompt it to generate, let's say, search strategy that you will use to get your scoping reviews. So this is still chatting. This is an example. This is one of our studies in our scoping reviews at my PhD. So we had to provide, the author and the year, the study design, the methods that were used, the location, then the intervention, the objective, the primary outcome, the effect, and the key findings. So all this, so you'll find you come up with, so as a take-home exercise, of course, you can go and search for papers. Look at your topic. I know not all of you will come up with a scoping review, but those of you that want to do it, you get your topic, put it. It's okay. You can put even a junk and whatever and then you put. But based on the search, what we've been highlighting here, you can get the keywords of your topic, put it in your study. And then you look for the studies and look for, let's say, like 20 studies, of course, and download their PDFs, then read them and extract the information. So you get the study design, the kind of intervention that is being searched, the objective, the primary outcome. You don't have to report the effect if they don't have, because some of them may not have. But this one is usually, for example, if this was a scoping review, you'd look at the effects, and then all the p-values, and then, but because this was scoping review, it has everything, and then the main findings, you also report it there. So this is, so you need, each scoping review must have this table, characteristics of the included studies, because you have to each of them. If you got 20 studies, you need to extract their findings as this. This depends, you don't have to include all these characteristics, but you can just pick out that you feel are necessary. And then some studies, thank you, Dan, some studies may not have subjects per se. For example, if studying a digital system functionality, any tips for this? So if you're looking, let's say, at a digital system functionality, I think you can, for example, look at, you can look at studies, if there are studies that have implemented this digital system. And then, of course, you pick out, you can extract different functionalities, especially. So let's say, if you want to look at clinical decision support systems, that is just an example. You want to look at the functionalities of clinical decision support systems. The functionalities that are in Streamline, they are totally different from what is in Clinic Master. So it depends. I don't know if I've got the question well, but you can look at different digital systems and the different functionalities they explain. So you'll find, let's say, let me give you an example of those clinical decision support. So you find this Streamline, maybe they have a dashboard for reporting maybe symptoms. But you find Clinic Master or Open MRS, they have different other functionalities. So I think you are not limited. You can look at these generic clinical decision support systems. You document, let's say if there was a system that was carried out in Kenya, you just bring it. And then you highlight, you have a table, you talk about these different functionalities of this system, and then you report it. As you're looking at it, of course, you may find those ones that you may find some of them that probably that are diverse or that are divergent, and you can just report those. Yeah. So, Dr. Dan, I don't know if that's clear. So you can the functionality aspects, or you can just look at the digital system, but it can't be one paper. Yeah, so this means that these are many papers that report digital systems. So a digital system that was implemented in US, in China, in Kenya, in whatever, and then you extract the components, yeah, the functionalities or the requirements or the technical details of this system, you document it. So you go to the one that was written in Kenya. It had a login detail, it had dashboards, it had a cloud server, it had storage, it had reporting. Then after you go to the one that is in Kenya. This was a study that was carried out in Kenya among 220 patients. It utilized A, B, and C. That is how you can, I think that is how you can go about that. Yeah. And then we have the search databases, of course, that are very important for you to look at. Yeah, like I've already said, we have PubMed, we have Cochrane. This one is for systematic reviews. They provide, these guys, if you land on a systematic review, some of them take years to build. So you find like a systematic review paper has 70 pages in Cochrane. You can check out that database. And then there is Science Dialect. This is by Elsevier. There is Google Scholar, is a very general person. Yeah, it picks all the papers from all these data sets. Yeah, and it just provides them, freely available. But of course, it has weaknesses. It brings deep duplicates. It has limited search filters as opposed to these general ones or systematic ones. So you can, those of you in computing, you can check out the SEM. We have Ovid Medline. We have IEEE Explorer. There are many databases. Those in businesses, there are very many databases that you can use. So this is a generic structure of your review paper, Scopy. So you must have a title, have an abstract. Usually the abstract, we write it at the end. You write it when you finished everything. Introduction and background. I know you guys, but this introduction and background must include the research question. And then you go to the method section where you talk about your main methodology. Which methodology are you adopting? Is it Axie and O'Malley or JBI? Then you highlight how different studies are going to be identified. You talk about the search strategy, the databases that you're going to use. You define them, the inclusion and exclusion criteria, then data extraction, for example, the characteristics of the studies, the study setting, study design, intervention used, outcomes, study duration. So this one is not quality and the risk of bias. This is not for scoping reviews. It is not compulsory. It is not, but for systematic review, you must include it there. Then results, you have to show the search results by including the table 1 findings. Then you have to either provide the descriptive statistics. Then you need to provide a discussion. by providing the summary of evidence, the strength and limitations, and then the conclusions. And then you'll be done. After having this, then you will have, of course, you need to have a journal, choosing the right journal. Yeah, we always encourage you to choose the right journal. Please, there are what we call shark journals. Avoid predatory journals. We know there is pressure to publish. You want to graduate, but you will submit your work and it will not be, it may be accepted, but it will haunt you later. So talk to colleagues at those of you in the digital health. We have curated some journals that can be helpful. You can also talk to colleagues. You can look at articles on your topic or similar topic and see what journals they are published in. And then you can look at previously published articles from journals that you're considering. There is a software called Gen. Yeah, Gen. We will get some time and we'll also look at some of these things. So Gen is, you can search it out. It is a journal author, I don't know, I think, then estimator. So this one, you can search it, you can type your article, and they bring different articles that have been published, but this is for biomedical data. Yeah, so this one picks them from PubMed, and then you can check out the journals where some of these articles have been published. Yeah, we advise that, you can check out, we have some well-known publishers where you publish your work and no one will question you. You need to think about the Elsevier, the IEEE, those in computing. We have Springer. It has everything in business, in agriculture. We have SCM, we have Sage, we have Taylor and Francis, we have Wiley, we have the BMJ, we have PLOS, we have Oxford University Press, we have Cambridge, then we have a user-friendly one, we have Agile. Yeah, some of these are very important. So before going to search something, we have a very important, our progress. So as part of this, we always have, every end of the month, we always have a doctoral research progress forum where people in digital health field can actually showcase their work, receive feedback. So what we do, we get, if one is interested, they write to us and then we look for an expert in an area. So this is Dr. Lilian Muyama with a panelist from Makerere Department of Computer Science. And then she will be the one, of course, that looks at or that gives this gentleman questions. Yeah, so as you have questions coming, let me try to do something little. Thank you guys for your patience. Let me see. Let me share my screen and then we search something a little and then we can just get out of this place. Thank you guys for your patience. I think this being our first bi-weekly seminar. And thank you guys, those of you that have joined us. So if we come, so we are going to check for PubMed, let's say. So PubMed, like I said, it is, I don't know whether you guys are able to see my screen. Are you guys able to see my screen?
Yeah, we can see.
Okay, thank you. Yeah, so now I want someone to give me their topic and then we can be able to fire out something and then you see any volunteer. Yes, Mary, we shall get the recording. Yeah, any volunteer to give us their topic. Sam, you can tell us your topic.
Mine is a framework to address preeclampsia.
Okay, so let's say preeclampsia, say mobile health interventions for managing. So I'm just typing a general topic, preeclampsia. So now, of course, this is PubMed, but I've just put the general term, and see, they have brought me how many results? They have brought me 60 results. So when you come to PubMed, of course, not everything is, so what they have done, as long as the paper has preeclampsia, managing mobile health, they will bring it for you. But of course, they give you, so in this case, they have given us 60 results. So these 60 results, of course, you can further go ahead. For example, now it allows you to filter according to the years. Maybe say you want data from maybe 2020 to 2026. You can have as old, you can have as many years as you can, but you see when I reduced, they have given us only 42 results, yeah? And then when we come and we say, of course, you can further go ahead and look, you want free full texts, you can check it out, and then they will further reduce them to 37 results. And then, of course, you can further select what you want. Do you want only clinical trials or randomized controlled trials? They will tell us that we have this, there are 8 randomized controlled trials that have been what? That have been used. Yeah, and then they will just talk about, yeah. So all this is how you can play. And then after getting your search, after getting your details, then you can click, you can come here. There is this option of send to. When you come to send to, you can just come, let's say, let me say clipboard. So when you come and say, let me see, okay. You can send to clipboard, you can just send to my bibliography, you can send to collections or to citations manager. So in an event, because we want, let's say, to take our results, these papers in, let's say, to a citations manager, or we want to screen these papers, of course, before including them, you can select all of them, or you can select those ones that you're interested. Yeah, but in an event, you just come to this send to, and you can say my citation manager, and then what it will do, it will just create, you can say all results or all results on this page, then you create a file. So when you create a file, so it has brought us something that is downloadable, that we can download our results and we put it, let's say, in our software like EndNote or in Mendeley or any software that we are using. So when you click this downloaded file, so it has opened. Let me stop sharing and share my, let me see if I can. Okay, so if I come to, let me share my EndNote. Where is it now? Where is EndNote? Yeah, so this is my EndNote. Yeah, so they have brought them for me here, and then I can simply expand, let's say, look at the titles, and then I can exclude those ones that I don't want. Let me see. Yeah, I can look at this. This was a community level intervention for preeclampsia. This was for implementing self-management for preeclampsia. All these details, and then if they are necessary, you include them. Of course, those of you that are not familiar with referencing, we can have another session of using these softwares. Yeah, but don't worry, I'm also going to show you how you do the extraction in how you do extraction in Excel. Yeah, like that. So what we've done, let me come back here. So we've come to PubMed, yeah, So you need to learn, you come to send to, of course, you put your results or your studies, and then you just come after getting convinced that this is the best match, you come to send to, and then you come to citations manager. It will create a downloadable link. It will compile all their references for you to be able to take them in your citation manager. And then there is PubMed has an option of, advanced. Of course, I know you guys have known some of these things, but when you come to advanced, see where we are. Now, remember, these were things that we typed, especially about preeclampsia. So it generated searches for us, or the search, what we call the search strings. So you can come here and see the details. I know you can see some of these things. It applied it in its own wisdom. It came up with the mesh terms, all these details. Remember, we're not doing it, but for it at the back end, it was running this. And now you can copy it and you attach it as a search string. Of course, this is needed by the journals. And then you put it, you can just copy and paste it in your Microsoft Word, and then you paste it there. Yeah, so Google's PubMed also allows you to put, so let's say you can add few words, let's say mobile health. Okay, let's say you can build the keywords, let's say mHealth. And these are Boolean terms you search. So when you say add and, it means that this is a different word. If you say or, the word can be mHealth or mobile health or ICT. So you can say add with or. So you have to see this, what is happening to the query. When we type a word here, it comes to the query box. So we say maybe mobile health, and then we look for an option. This becomes like, say, add with O, and maybe say ICT, and we just add it with an O, and then management. If you say management, now this is a new term, you add it with an and, of you can say pre-eclampsia. I don't know the eclampsia. I don't know the right word. So you come here and then you say and like this. And then you put search. So you see it has brought us 9 results. Yeah, but then some of these 9 results probably, because some of them, so here we have the effect of a self-monitoring of blood pressure on blood pressure control in pregnant. But here it is highlighting words like management, etc. So it depends on how good you are with searching. But if you don't want to burden yourself, you can simply type your word. Let's say, sorry, let me just move this up here. Let's just come, let's say, to ChatGPT and just tell it, prompt it, let's say, I am building, I am writing, I'm trying to write a scoping review paper about mobile health interventions, management of pre-eclampsia. Okay, help me develop a comprehensive search strategy that can be used in PubMed. Okay, So this is what we've said. So let's see what it brings for us. So here ChatGPT is telling us, okay, great topic. That is, so now what is this thing? Of course, it also, ChatGPT also has, So it has brought us some of the, so when you come here, it has brought us the key search blocks, the key mesh terms, mobile health or digital health, what you need to consider, telemedicine or whatever, monitoring. Now it combines, say, the final combined PubMed search string, and this is what it brings. And then you can, of course, we were able, we can maybe, because these ones we just want to put the possible, let's edit it and say we just need keywords, say comprehensive keywords, because PubMed will just develop the search strategy for us. And then let's see what it edits for us. Yeah. So here, okay, so this is the full Boolean, blah, blah. Okay, interesting. So let's see. So here, it brings out all these things, of course, but let's see, they are trying to tell us we can use, let's just copy this and take it in our PubMed and see what they bring for us. If we put it in PubMed, and let's just put search, and we see, sorry. Hi, this is very interesting. ChatGPT, what? So it has brought for us 230, 200,000, whatever. So, but you see what it has done, what I've appreciated is that it has brought this mobile electronic clinical, whatever, all those, and then, so let's try to reduce the words, the years. Let's say we put 2020, 2020, yes. So we put 2020, still these are very many, yeah, but probably it brought the other cities. No, we don't want other cities. Let's just, yeah, but then of course this means that there is a challenge. Of course, this, you're not supposed to get these many results, so it means that there is a problem. So you don't need to, because it now it you just need to get, as of course I think the prompting is challenging, but the more you prompt it, it can give you better results. Yeah, so this is, of course, you can use some of these tools. You can just I think our first one was a bit better. Yeah, and then you can get some of these details. And then after getting, let's try to see if we can send all these results to EndNote and see what happens. So we will come, we send them to our citation manager. Yeah, if there are many, you don't need to take, you can take maybe those ones on the page, but you can say all results. But here they are telling us that only the first 1,000 citations will be saved in your file. Then you go ahead and create the file, and then the file will be saved. So it means that we are creating a downloadable file of 1,000 results. But of course, these ones have, it was bringing things, the effect. So any study that has the word effectiveness, evaluation, it brought all of them. So lastly, of course, based on the result, of course, like we said, which papers do you select? You select those that fit in your problem statement, and then you just incorporate them in your work. So let's look at Google Scholar. That there is a component that that I use to save my papers. So I come to, you can, so if I've come here, let me just come to, let me just come here and bring my prompt. Yeah, so if I come and say mobile health interventions for the management of preeclampsia and type it in Google Scholar, and then we see the search results. It has brought me 19,600 results. Also, Google Scholar can allow us custom range, can say maybe from 2020 to 2026. Oh, I also didn't specify. The other many results you can reduce, say maybe in Africa, in Uganda. Yeah, so you can just reduce the scope. So here we can put the search. It has reduced it. Now here, let's say in Uganda, and see what it brings for us. It has brought us 658 results. And then we see there is an mHealth promotion intervention that was used for maternity care services. Yeah, and probably the eclampsia was among. So there is this one, preeclampsia monitoring device. So let's say you have seen these papers and maybe you come and say, of course, there are other things. For example, you can say terms like you put them in comma, yeah, and then you see what it brings for you. You see how the results have just by adding this. Let me just show you. So originally we had only we had 6,580, but when I put comma, just this invert, are they called quotation marks? So it has reduced them to 354. So what we are saying that because now it will look for any paper that talks about the word that brings mobile health, and it will just bring, that's why, so that's how you can reduce the search. So at least the 354 is manageable. So documentation, of course, you have to document that you take these keywords, and of course that these are the keywords you entered. Let me just first remove this thing. Management, interventions, management, preeclampsia in Uganda. So here, so you just come and take these keywords. So for example, so you have to write them because you have to document. Then you have to state that in Google Scholar, we got 384 results. You copy this and put it in your work, or somewhere you're noting, and then you put the number of results. The same thing with PubMed, the same thing with IEEE Explorer, Science Direct. So what do? You have these papers and you want to screen them. So you have, Google Scholar has an option. Of course, not all of them are important. This is a scoping review, will not include it. But you can take it but you have to document. You don't just exclude the paper. You have to explain why you excluded the paper. Remember the flow diagram that we had. So you come, it has an option of save. Come, click save. When you click save, Google Scholar allows you to create a library. So don't worry about, these are my libraries that I've created because they contain the papers or the reviews that I want to do or that I've developed. Yeah, so you can come to Google, but for yours, as you're searching, you'll find there is nothing. So you come and create new, and then you just call it, let's say, mHealth preeclampsia. Yeah, and then you click done. So what you're doing, you're saving these papers for future reference, that instead of coming back to run this search strategy, you just come back to your library and then get those details. So every paper that you see that is in line, you just come. Unfortunately, Google Scholar does not allow you to select or to have all of them. To select, like how we're doing in PubMed, so you have to go to a hard way. So here you come and save. This one makes sense. You come here. Let's see, mHealth preeclampsia. Look for your file. You put it. You come here. You put in your file. Here it is. You save it there. etc and etc. After exhausting and you feel like you've taken the papers that you want, now when you come to my library, you come to my library here where my cursor is, you come to my library, and then you look for your folder. So these are the folders. So now our folder that we created is mHealth preeclampsia. So we come and select a folder. So it has 1, 2, 3, 4 papers. So now, how do we take these? You can take them to a bibliography by exporting. So it gives you an option of exporting all of them. You've read papers, they say papers were excluded on title, they were excluded on abstract. So you can just come, export all. Now when export all gives you an option, can select as BibTeX, EndNote, RefMan, CSV. So if you have EndNote like me, you just click EndNote and then your papers will be taken. But if you want an Excel file, you click on CSV and then, so they have created the citations for us. So here, now you just click on it. Clicking it means that you are actually yeah. So these are the results. So these are our papers. Of course, you'll be having very many papers. Yeah, you'll be having very many papers, and then of course, so we have a paper by these guys. So these are the authors. I think the interest is this. So you look at this based on, this is how you screen on titles. Look at it, this title does not make sense. It is a protocol. It means that it does not have results. Do I need it? No, I don't need it. You kick it out. Digital health interventions, obstetric, this is a scoping review. Do I need it? It is already a scoping review. I don't need it. Preeclampsia monitoring device, do I need it? Most probably you need it. Evaluating the feasibility of support moms. Do I need it or I need it? Maybe you need it. And then you just, until you finish all your studies, and then, so that is how you extract some of these things. Interesting. I think, is there any question? I know you guys have very many questions, but I think this is a good start. Anyone with a question before we just conclude? Are you guys still here? Yes.
We are still there, doctor.
Yes, Asa. Do you have any question?
No. I'm just. I was looking at the methodology where, I mean, the literature review we have been using, but I see in my topic. I think I'm likely to use like 3 of them because systematic and this other 2, they almost give me the same results on what I'm looking at on my research, because I was looking at the I was looking at the systematic review approach, which is giving me both the leading me to the objectives. Then if you look at the other first, is it conceptual review? Because they're all giving me the different results, but all of them are needed in my research. So that's why I was asking: is it possible for someone to use both conceptual review and the systematic review? And if you go ahead, you'll find out that there is also methodological review. I don't know where that one focuses on. Because methodological review, that one, I think you look at both quantitative and qualitative. But there was some lecturer who was telling us that when you are at a PhD level, you don't say quantitative and qualitative. There are other words you use. You don't just say qualitative and quantitative. That is for maybe bachelor's level. So the whole thing is becoming just advanced.
I know. Yeah, but I think Asa, no, I think for your topic, it will be a scoping review. I think it's because systematic review will need some very there are not because I don't like a systematic review that does not have, let's say, effectiveness, or like I find it challenging when someone is talking about. So for us to be not on the wrong side of things, I think we are safer with the scoping review. So don't be confused with the systematic. Just we will look at the systematic review in the subsequent sessions, and you guys will also appreciate and see. Yeah, but I think for now we don't need. ASA we will keep in the confines of the scoping review.
Okay.
Yeah,
Thank you,
yeah.
Doctor.
All right. So so I think to begin with, try to put your, like how I've done. Samuel gave me his topic, and then we just put the keywords in there, and then we were able to get some papers, were able to save them from PubMed, Google Scholar. Try to do the same. Try to apply some filters and try to get some papers. Try to get some lads. If you get, you might be asking, how many papers? If you can get 10 and above, you are very good. But if you get 7, if you get 5 and whatever is good, but 5, it may need, you need to do a better work. Yeah, but at least 10 and above, you're safer. Yeah, so I think, guys, I think that's what I can share. So try to, of course, it would be wrong for us to leave this and without any action point. Try to go, the work that you're working on, try to go and come up with, first read some scoping reviews and see how people wrote their scoping reviews. Yeah, especially the people that you trust, especially look at people in Harvard, look at and see how they wrote, and then you can learn a lesson or two. And then you can also borrow the same idea, get some papers, put your keywords based on the research question you've defined for your paper, and then you come up with the papers. Go to Google Scholar, go to Science Direct, go to PubMed, put them and see what the results that you get. Document each of those results, go through process by process. How do you exclude them on title? Those ones that you choose, how many that you exclude on abstract, etc. like that, and come up with this table. Come up with this table. Let me see. This table that I shared, there is this table, this table. Come up with a sample table like this. You can take a screenshot, or you can get those scoping reviews that you read about and see what kind of characteristics they're reported, and try to come up with something, and you'll find something that is meaningful. Of course, it depends on your research objectives or the research question that you want to investigate. Okay. Any words anything else? Anyone that has? Okay, if there is no question, I think.
Thank you so much, Doctor.
You're welcome, Mary. Thank you. Thank you so much.
Yes, I wanted to say that questions may not come up now, but for us who are going to start writing, I believe in the middle there, that's when we shall even actually have questions that you'll already be gone. So I would like to ask you kindly, in case either we come to your email or your inbox, please.
That's very okay, please. That's why we are here. Yeah, we will do that. Yes, Samuel, you had your hand up.
Yeah, I wanted to suggest the same thing. Thank you so much, Doctor. I wanted to request that maybe we can have this as platform as a continuous one. We keep, bring up questions in the chat because Zoom can allow that. I don't know whether it was activated. Yeah. So that we don't go off track. We don't fill your emails with the same thing. We can show the same, presentation. Otherwise, it was really a nice presentation. It's the first time, I think. Yeah, we're just starting. But I think I've never learned before. This was the best for me. I've learned a lot. Thank you very much.
Thank you so much, Samuel. That's amazing. Thank you. Yes, Dr. Dan. Dr. Dan is our director.
Yeah, thank you. Yeah, thank you very much.
Yes.
For this very insightful presentation. Much more detailed than those you've given before, especially around how to use the different approaches to do the search. And my question is on, do you disclose, if you're writing the methods of this paper, do you indicate or disclose that you used artificial intelligence to generate a prompt for the search script? Just that advice would be helpful. Thank you.
Yeah, thank you. Thank you so much, Dr. Daniel. Yes, actually, some journals, there is that when you publish, sending your paper, they will always ask you to declare how used AI to actually in any way in your work. Yeah, so it's you can always declare there is no crime. Because everyone uses AI. Even Google Scholar. Did you guys know that Google Scholar is an AI platform? It is an AI platform. Did you know that Turnitin is an AI platform? But of course, those are generic. They utilize AI components. Yeah, so I think it is okay. You can declare, but there are things you don't need to declare, especially if, for example, now running keywords, some of them, but if you feel there is need, of course, based on, if you want to copy that search strategy and put it in your work as you got it from the AI, you can declare that. Yeah, so there is no crime in doing that. Yeah, thank you so much, Dr. Daniel. Can this platform be used too for our presentation on how far we've gone with our work? Yes, I think that's why we had those. We are creating a timetable for those. We will surely, when your turn comes, but because the numbers are many, and then we want to. Sometimes you wish you had more. But we'll keep on. But for the progress of our work, we'll always have some of the internal, of course, with your supervisors. And then, of course, this one can be generic because different people, you're presenting different people. Yeah. Nuriat, thank you so much. Doctor from different faculty, but I have appreciated attending this. Thank you so much, Nuriat. We are so happy to have you here. We will always be here. We will always be sharing some of these opportunities so that you guys can be part of this thing. Yeah, all right. So I think we can end from here, and we say thank you guys for attending, and I think I wish you all the best in your work. Please don't go and sit, go and work on something. Try and do something on your work, and then if you have already gotten research ethics committee, you can go NAMBA and UNCST. You can always go ahead and you publish, submit a scoping review. For those of you that are at the conceptual level, it's a good way to start. It's a good way to start to know so that when time comes, you have become an expert. Don't just wait, go and work on it. Go begin, work on your paper, and then so that when the right time comes, you can share it with us. We just read through, we tell you what is missing, what needs to be added, and then so that we give you feedback. Yeah, so thank you so much, everyone. I think it's been great meet. Thank you, Sam, for sharing the link with colleagues. It's a motivation. And I think sometimes you don't know how much small things mean, especially until you do them. So thank you so much. I will always communicate and especially, so that we continue supporting each other. Thank you so much. Have a wonderful night or a day, those of you that are not in Uganda. Wishing you all the best as you are continuing with your work.
Thank you, Doctor.
Good
Thank you,
night.
colleagues, and have a good night.
All right. Thank you.
Good night, everyone.
All right.